The Mediterranean Sea is much different than the sea of corn and soybeans that I grew up among in Iowa. It's a pleasure for me to be here. I want to thank Verbac for inviting me and giving me this opportunity. It's an honor for me to be able to speak to so many colleagues from around the world that share my commitment to the pork industry. Would you please, how many of you people in your service to the pork industry routinely do necropsy examinations on swine farms? How many of you do? Good. Maybe about 1/3 of you. I suspect that has something to do with the way that the industry is structured in your country, as well as the availability of diagnostic services to you where you are practicing. Today, I want to talk about doing necropsy examinations on the farm and the importance of doing that in order to solve respiratory disease, or at least control respiratory disease to the best of our ability in swine operations. I think most of us, especially if you're my age, when you were in veterinary school, we learned about various causes of pneumonia as individual diseases, either viral diseases, influenza, Algiskis, bacterial diseases, actinobacillus, pleural pneumonia, and others. But I think that we all now understand that we most commonly see complex diseases associated with fatal respiratory disease on our farms. In fact, recently, the last few years, we began using a new term to describe this. We borrowed this term from the cattle industry that talked about bovine respiratory disease complex. The idea of using that term in the cattle industry recognized the fact that respiratory disease in cattle usually was associated with the combination of often a viral or more than one virus with more than one bacteria causing high mortality in cattle. We recognize that the same thing occurs in pigs, and so we started using the term porcine respiratory disease complex, or PRDC. In PRDC, in the same way that people have understood cattle disease, we recognize that the agents that cause pneumonia can be divided and should be divided in the way that we think about them into two broad categories. The first category would be those that are initiators or primary pathogens, initiators. The other are those that are followers or secondary pathogens. What do we mean by this? When we're talking about initiators, we're talking about organisms that in a normal, healthy pig, if we inoculate that organism into the pig with normal lungs, it has the ability to cause disease by itself. Most of those agents that are initiators do so because they have virulence factors that are able to disarm or damage the normal defense mechanisms of the lung. Generally, they do that by either damaging the cilia in the airways or the ability to produce mucus, the mucociliary apparatus that's so important for clearing microorganisms from the lung, or by damaging the pulmonary alveolar macrophages that are in alveoli, again, damaging the lung's ability to clear organisms from the lung. The second category, also, the important thing that we need to remember about these initiators are that when we are working with swine farms, it is very important that we try and identify the most significant initiators to respiratory disease, because those are the agents that we need to focus on in order to truly prevent or control respiratory disease on those farms. When we compare that to followers or secondary pathogens, we're talking here primarily about bacterial pathogens that produce pus in the lungs, that follow into the lung after primary damage caused by the initiators. Those followers, if you take those organisms and inoculate them into a normal lung, a healthy lung of an individual, you cannot cause disease with most of those organisms without first damaging the lung. Does that mean that the followers are not important? No, because the followers, once they establish in a damaged lung, can then begin propagating themselves, and they are often the primary cause of mortality and death in the pigs once we have pneumonia. So both are very important. Let's look at some of the primary initiators that we're concerned about in the followers. And I'm sure in some parts of the world that you're from, there may be additional ones that we would add to the list. But generally in the world, I think we recognize as a very significant initiator PRRS virus. PRRS virus replicates in macrophages. It damages the ability of the lung to clear bacteria in the macrophages and causes immunosuppression.